The university wants to bring its global research expertise to the service of the local region. In fulfilling our mission to contribute to society through the pursuit of education, learning, and research, we are fundamentally committed to engaging with communities and partners close to home. We do this with agriculture, working with farmers and industry to increase productivity sustainably right here in Fenland.
In the east of England, we have very flat, well-drained, fertile soil that accounts for half of the food production for England.
So agriculture is really important for the eastern region because of the amount of jobs and employment that we can provide to local people here and the contribution that we can make to the economy with the healthy produce that we're making on our fertile soils.
Well, there are lots of factors coming together that are going to affect global food production. Climate change, recruiting workers for farms and factories, and an ageing population all have an effect on ensuring we have food for the future. Technology is where we can find solutions to do this without damaging the environment.
The links between the university and GEES go back many years with many successful projects being run. The work that we've done together is focused on areas of expertise that we don't have internally in-house, which means it's great for us to be able to work with university colleagues.
We've worked in areas like supply chain management, computer vision to detect the maturity of crops, and also most recently in robotic harvesting.
So we're really excited about the links and the projects that we're running with the university, as we believe we're tackling a crucial problem in agriculture, which is a skills shortage in robotics, autonomous systems, AI, machine learning, areas that we believe will be really fundamental in improving the productivity of agriculture in the future. We know as farmers that it's very important that we are managing our environmental stewardship so that we can farm safely and productively in the future.
The region has many assets: innovative and entrepreneurial people, clusters of knowledge-intensive industries, high-quality agricultural land. But it also faces multiple challenges, including economic inequalities. One project with a Cambridge-based housing association, CHS Group, is helping people furthest away from the job market.
Alongside the economic prosperity that we see in the East of England region, there are also significant levels of deprivation. In fact, some of the wards in the Fenland area are not just some of the most deprived in the UK, they're some of the most deprived in Europe. Now, the university produces world-leading research, but it's really important that we also work with the communities that are right on our doorstep.
So a lot of the people, when they first come to us, are in financial crisis. They're not managing to cover all of their expenses. So each of our delivery partners employs a coach who work with people for up to 20 hours. Within those 20 hours, they'll focus on what that person needs. They'll be looking at making sense of their money, at helping them get online and helping them get closer to the job market.
The Department of Land Economy has been involved in the New Horizons programme as an evaluation partner. So what we've been doing is carrying out a programme of action research. So right at the beginning of the programme, we worked with CHS to set up the evaluation tools, to work with them to decide what data do you need to collect in order to measure the impact of the New Horizons programme.
The people who are on it, we're seeing huge changes for them. So it's great that we're able to continue to deliver. The funding's just been extended for another 3 years. So that will be another around 300 people who get to have this one-to-one coaching.
For individuals who've gone through the coaching programme, they have not just learnt new skills, but they've gained confidence, they've gained self-esteem, and one of the impacts of this has really been on improving their mental health. So many of the people, when they began the programme, were under severe stress and suffering mental health impacts, particularly as a result of high levels of debt. And one of the impacts of the programme has been to give them self-confidence, self-belief, not just to tackle those problems, but also to believe that they can put themselves onto a pathway to a better future.
We have researchers working with organizations across the region on environmental issues, including how coastal erosion can be managed for the future by working with nature rather than against it.
With much of its flat and marshy lands, the East Anglian coast is very vulnerable to sea level rise and to flooding. It's also home to nationally important infrastructure, to some of the richest farmland around the country, to important tourist areas and many homes and people, of course. In order to protect all these assets, we need to look at managing the coast sustainably into the future. Here at Cambridge University, we are looking at a creative way of doing this by taking into account the natural coastal protection that environments like dunes, marshes, estuaries provide to the hinterland. To test this, we excavate and transport soil cores into large wave flumes and then expose them to waves to see how much energy these landforms can withstand. By working with the National Trust and the Environment Agency, for example, we can then develop sustainable management programs for the East Anglian shores. So we can get away from hard coastal engineering structures and look at alternatives like natural landforms and working with nature to allow the coast to adapt to a changed future.
We're working with communities, doctors, and hospitals across the region on public health, the National Health Service, and how people can stay healthy and active in their later years, including whether portable monitors can be used to screen for a heart condition called AF.
AF is atrial fibrillation, which is essentially your heart, rather than beating regularly, it beats irregularly. And around 7% of people over 65 have it, and it increases the risk of stroke 5-fold. The cost of that in Europe is around 10 billion euros per year. So if screening could find people with atrial fibrillation and they could be offered anticoagulants, it might reduce their risk of stroke, and that might improve their quality of life, their length of life, and reduce the cost to the health system. There are a number of different ways that you might want to test for atrial fibrillation.
So screening for pulse when people come into the surgery is quick and simple and relatively cheap, but we know that it misses people. That's the thing.
One of the approaches we're using is a screening tool that's a bit like a mobile phone. Patients can take it away for a couple of weeks and they can test themselves just by putting their thumbs on the device, and it measures their heart trace. We're in the pilot phase at the moment, or the feasibility phase, and we're working with practices in the eastern region to test the feasibility of the screening program and the feasibility of the study to evaluate it.
And so this gives us an extra dimension to check. And this is about clinical effectiveness and cost effectiveness of using this type of device, and that's the answer that will be of use around the world.
In the region as elsewhere, there is always more to do. But the breadth and longevity of our mutually beneficial partnerships show the importance that these relationships have for us. Our academic community remains open to new and creative forms of working with partners in the east of England.